Hey everyone, it's Tracy. Today I wanted to talk about ketamine for treatment-resistant chronic pain. I am not a doctor, I'm not a medical professional, I am a chronic pain patient, and this is just my personal experience and how I came to be using ketamine for my treatment-resistant chronic pain. I have 4 different chronic pain conditions. I have intractable migraine, and I've had migraines for 40 years. And intractable just simply means that my migraine pain never goes away. And yes, right now I have a migraine, but my pain's only at 4. I have fibromyalgia. I have osteoarthritis. My particular osteoarthritis, I have it in my hands and my wrists. But I have facet joint disease, which is just a fancy name to say that I have osteoarthritis in all of the joints of my spine, from my neck all the way down. And I have occipital neuralgia, which is an inflammation and damage to the occipital nerves that come up out of your neck and go on either side of your head through your eyeball. And that is actually a separate condition from migraines. And so those are my 4 chronic pain conditions that I deal with to varying degrees every day. Sometimes things flare. I can get injections for like the osteoarthritis, and that can help for a little while. But the migraines and the fibro have been treatment resistant. So I first heard about ketamine through Chronically Jackie, and I will link her channel below. She is a chronic pain patient. She has Ehlers-Danlos syndrome, or EDS, which is where you have hypermobility in all the joints of your body and it causes pain. She also has some migraines. I don't think she has chronic migraines, but she does have migraines and daily headaches and a few other conditions. She's got some different conditions that I do, but she was having issues. She has allergies to a lot of medications, and anyway, she did some research, found out about ketamine. I learned about it on her channel, and kind of watched her struggle to get ketamine for treatment for her chronic pain and her journey to that. And I started researching it, and I will link some of the research that I found below in the description below this video, so you can go look at it yourself. But I started my journey to trying to get ketamine treatment after I learned a little bit more about it, approached some of my doctors, my pain management doctor, my primary, my neurologist, and trying to find a way, or any of them who would agree to do ketamine. So what is ketamine? Now, obviously, I'm going to link below to things, and you can go read more details, because I am not a pharmacist, I'm not a doctor, but ketamine is not an opioid. It is an analgesic, which is pain relieving, and anti-inflammatory, which means it helps reduce inflammation and swelling in your body. So those are both good things. It has been used since, I don't know, like the 70s or something. It started out as an anesthesia. It was used as an anesthesia. It is also used in veterinary medicine as a tranquilizer. It's still used today in some instances as an anesthesia. It is also used in ERs and in trauma situations where someone has like severe tissue damage or broken bones or something. They'll give ketamine because it provides an instant relief for pain and trauma and things like that. More recently, ketamine infusions have been used for like a treatment-resistant depression and anxiety, and it's been really good for that, for people who have suicidal thoughts or suicidal, no medications are working. They'll go do ketamine infusions, and within hours they're getting significant relief from their suicidal thoughts and their depression, where they haven't been getting any relief, or medications can take months or are not effective at all. But more recently, and I guess as a side effect of using ketamine in these other, modalities and situations, they've discovered that it also helps with chronic pain over time. Like anything, especially for migraine, or probably for anything else, the medications used for migraine, pretty much all of them, were originally used for something else. It's not at all uncommon to use beta blockers used for blood pressure or something else, or an anticonvulsant medication used for epilepsy, or a medication used for depression, or something like that, or even like a neuropathy, like diabetic neuropathy. I mean, these medications are used for a lot of other things. Their primary use was for something else, and they find, oh, well, it helps some people with migraines, and so those are usually the first line of treatment for a prevention for migraine, is medications that they've always used for something else. There's not really a whole lot out there that was primarily from the ground up designed and developed to stop migraines or prevent migraines or abort migraines. There's a couple, and I've tried those, and they don't work. So ketamine, which is a pretty potent drug, it is less addictive than an opioid, but it, like all medications, it can be abused. I think there is street use of ketamine in various forms, but then people illegally use, Percocet and all kinds of stuff. Just because it's used illegally and obtained illegally does not mean that it doesn't have any value in use in a medically supervised situation. The one drawback, or I guess the big reason or concern for ketamine, is it can have a hallucinogenic side effect. The first time that I used it, I went into my doctor's office and she supervised me to make sure that I didn't trip out or something. But to reach therapeutic doses of ketamine, it is generally and usually, like for the depression treatment, for example, and maybe for a more rapid or long-term, to reach a therapeutic level in your body, generally an infusion is what is done. The brick wall that I hit with that is, number one, when I first learned about ketamine, I reached out to my pain management doctor, because ketamine being an anesthesia, and generally the accepted fastest way to therapeutic levels is an infusion, I'm thinking my pain management doctor, who's an anesthesiologist, would be the one to administer this. He does not do ketamine. He said there were two doctors that kind of work within their pain management group that do ketamine infusions for depression only. I did call them. They said, oh no, insurance will not cover this. You have to pay for it. As long as the therapeutic dose for chronic pain is at or below the therapeutic dose that they use for depression, they would consider infusing me with ketamine, but I was going to have to pay cash, and it was going to be $1,600 or $1,800 for 6 infusions, and those would be several hour infusions, 3 or 4 hour infusions over the course of 6 treatments. I'm like, you've got to be kidding me. That is ridiculous. I'm like, I know as sure as I'm sitting here that my insurance would cover ketamine and it would pay 100% of an infusion. I know it would. I've got enough diagnosis codes. I have 24 chronic health conditions, 4 chronic pain conditions that are treatment resistant. If anybody would qualify, it would be me, and I know they would pay for it. And for an infusion or inpatient, outpatient procedure like that, my insurance covers 100%. I mean, I'm pretty confident they would cover it. but they wouldn't even submit it to my insurance, which was frustrating. So I reached out to my neurologist, and I started with a new neurologist in July. She has my history. She had all my medical records from all my doctors, because she's in the same group of doctors. Pretty much all of my doctors are in the same medical group. They have access to all of the records, and she can see everything that I've been on, everything that I've done, certainly within the last several years, you know, like maybe 20, 30 years ago, I was on different insurance and different, you know, maybe not in the same group that I am now, but certainly for the last several years, she would have records of all that. And she's like, well, no, I don't do ketamine infusions. And so I like, okay, let me, you know, I'm like, okay, she doesn't do it. She's like, no, you know, and I can't continue my research, kept trying to find a place that I can get to do an infusion that would bill my insurance, and I'm struggling. So a few weeks went by, and I reached out to her again when I kind of was hitting a brick wall, and I messaged her through like the message portal that we have, and I said, you know, are you sure you can't do it? Are you, you know, I'm willing to go inpatient. I'm willing to do. And she replied back and surprised me. She said, I've been doing some research. Believe it or not, you're not the only patient who has come to me. And she is at the neurology and headache center at a big hospital here in the St. Louis area where I live. And so I'm not the only one who's come to her. And so she started doing some research, and she said, I'm still trying to find a way to get an infusion done. I think she was hitting kind of a brick wall with hospital administration and who's going to oversee this, who's going to do this, how do they make this happen? You know, it's kind of I guess still not a common thing. And because of the potential side effects of ketamine, you have to be monitored so closely. And I think that's kind of the biggest issue with getting ketamine as an infusion. But she did come back and say, well, I do have one patient who came to me already on ketamine orally. And she said, I just continue that. She'll take a single dose, I guess, and she'll be migraine free for like 5 or 6 months. And she said, now you are different in that you are treatment resistant chronic pain, but she said, you know, I'm willing to give it a try. I can order it, you know, through the pharmacy. You can come pick it up and come into my office. We will give you the dose in the infusion room in my office where we can watch you to make sure you don't have a negative reaction. So that's what I did. It was like 2 weeks ago. She ordered a vial, it was like a 50 milligram strength in a 10 milliliter vial bottle, and I paid, I don't know, like $3 and something or $2 and something. I mean, it was ridiculous. My insurance covered it. And we got it upstairs, and she pulled it out. She goes, wait a minute, this is supposed to be oral, but it was in the vial like you would withdraw out for an injection or an IV. Called down to the pharmacy, and they said, this is the only way it comes. If you want to take it orally, you just draw it out and squirt it in your mouth and drink it. So that's what we did. And she gave me one dose, and we waited 30 minutes. Nothing happened. She gave me an equal dose after 30 minutes. We waited another 30 minutes. I said, well, it made me just like maybe a little bit relaxed, like calmed my anxiety, but it did not make me high. She said, well, let's stick with this dose, finish this vial, which would only be a couple of days or so, and either contact me either when you get pain relief or you run out of medication. So I did. A couple days later, I let her know, and I said, you know, I was starting to see a little bit more effect. I said it lasted for like 2-3 hours. Within 5 or 6 hours, the pain was back, but I did get some relief, not gone, but relief for 2-3 hours. And she said, well, ketamine is cumulative, meaning it builds up in your body over time. And, you know, I guess it's why they infuse it, because you need more over a period of time, and why they do infusions over several treatments to get it built up. And so she said, let me prescribe you 2 weeks worth of ketamine, take it every 8 hours, and we'll see how you are at the end of 2 weeks. So that's where I'm at. 2 days ago, I finally got the prescription in. She had to mail it to me because it's one of those, the classification is they can't digitally send it. They have to mail you a paper prescription. You have to take it in. I did. My pharmacy had to order it because, of course, like, who takes ketamine? Nobody, you know. That's usually in a hospital setting. So I got the vials. My insurance paid all of it. It cost me $6 for my 2-week supply of ketamine. So I'm telling you, people, if I can get somebody to agree to infuse me, my insurance would pay for it. Because if they would pay for vials of ketamine, why in the world would they not pay for a doctor to infuse me? I mean, that's just, you know, my insurance is exceptional, and I understand that that's not the rule. But it's a little frustrating when people go, oh no, insurance won't pay for that. They don't pay for compound blah, blah, blah. I'm like, well, my insurance does. So, you know, sometimes you have to really fight and be your own advocate to get anywhere with your treatment. You can't give up. So right now I'm out, I'm dressed, the pain mask is applied. I'm sitting in the Target parking lot because I can record easier without interruptions. No dogs barking. Nobody walking in on me. Slightly better lighting sitting in the parking lot. And I'm going to go in and get some errands done. So that's how much better my pain is. My fibro flare is easing. My occipital neuralgia, which was trying to flare up, is lessened. My migraine pain is lessened. It's not gone. My pain's not gone. But it's only like at a 4, which for me, it doesn't usually get a whole lot lower than that. I'll take it. I do not get high off the ketamine. I had one incident yesterday morning, the first time, not had it before or since, where I could tell, I'm like, whoa, okay, you know, I took some ketamine, and I'm just like, for about an hour, took about an hour until all those effects were completely gone, and I was completely back to normal. I took doses since then and this morning, and I never had that effect again. So I have no idea why I did it yesterday. But whatever it was, it only lasted an hour and then it was gone. So it is working. The relief does not last at this point. It's not like my pain's down to a 0 or a 1 and completely gone, but it is less. Usually I wake up in the morning and sleeping is so very painful for me, and I wake up in a lot of pain. And I woke up in pain this morning, but it was less and less intense than it normally is. So that's a good thing. I'm seeing some positive results. I will say that ketamine is meant for short-term use to build up to therapeutic levels. It is not meant to be taken ongoing for long periods of time. This is the reason why I've only got a 2-week prescription. We will have to very carefully monitor and limit the use of the ketamine. So I'm really hoping that in this 2 weeks that taking it orally is going to be enough. This is the reason why I was really wanting to do infusions, because I think you can get a higher level built up quicker than you can with oral. Liquid is better for me. I have malabsorption, so it's good that it's liquid. I think an infusion would be even better. I'm not going to give up on potentially trying to get an infusion, but right now I'm going to take what I can get. And let me also say that ketamine is for treatment-resistant pain only. This is not a first, second, third, fourth option. If you have chronic pain, you need to have tried pretty much everything else and nothing works before you even consider going the route of ketamine. This is not, this is not something that you just jump to right off the bat. You know, I mean, I've dealt with chronic pain and tried everything, even opioids, and it just doesn't work. So that's my story about ketamine. I'm still in the middle. I'm only 2 days in the 2-week prescription, but I had taken it, I guess, like 3 days the week before. So I started to see a little bit of relief. So I'll check back in at the end of the 2 weeks to let you know. But that's my story of ketamine. That's how I found out about it. I did my research, talked to my doctor, kind of had to go back and forth to get her to agree. But that's the reason why I'm doing oral ketamine, not infusion, because we're still trying to find a way to make that happen, that the hospital will agree to, and how to do the protocols and who's going to monitor it and things like that, because there's not like an established protocol for that, at least with my neurologist in the hospital that she deals with. So that's my story of ketamine, and hope you found it helpful. Read the links below, and I guess reach out to your doctor and you know, start a conversation. That would be my advice if you are having treatment-resistant chronic pain. So I will talk to you later.